microscope, and they tear the part of meniscus that's on the way of joint, or they repair that meniscus. If it's not bad enough, then people are young, then it can be repaired. And we have a knee replacement also, the joint replacement, which is the 3 big surgeries that we have on the knee. We have a lot of other surgeries too. We definitely have a tibia fracture, they put a rod and stuff like that. And these are also some surgeries, but these are not too often. So I want to talk about each surgery first. First of all, for the meniscus tear. Meniscus is the cushion in between 2 knees, bone of the knee, the femur bone and the tibial bone. And if this cushion is torn, that hinge, imagine that hinge motion can get affected. So if you get locked on your knee a lot and you cannot move it, it gets locked in extension or flexion, make sure you check for the meniscus, check with the doctor with MRI. If you have a torn meniscus, if it's not bad enough, sometimes it can heal by itself with physical therapy. If it's bad enough, you have to do meniscectomy, take that part out. So imagine like a door, when the door gets open and closed, if something is between the hinge, what happens? The door stops. The same as your knee. So they have to take that part of the torn meniscus out until you get freely moving. So if it's not bad at all, then they can repair that part of meniscus and hope and that it will heal, although it's doesn't have enough blood flow, but sometimes it heals really good for the younger people. And also another surgery is the ACL grafting. Sometimes they have to take your ACL tears, the cruciate ligaments that I talked about, they are inside your knee, and if they are like this, that cross inside the knee, and they keep that knee from moving front and back. How you test for that? You can just put your knee on top of something, and we bring it front and back, like a shearing force in front and back. You are holding in here and bring your shin front and back. If it moves a lot, which in my case it doesn't, then or it hurts a lot or moves or cracks, then you're gonna have cruciate ligament tear. This is anterior posterior drawer test. You can do it at home, but basically leave it to your physical therapist. If you can't do it, then they're gonna do it for you. If that torn, then sometimes they have to graft it from your own patellar tendon or from your hamstring tendon in the back. And if they have to take it from that to graft it to your ACL ligament, sometimes you have to make sure that you do enough precaution for your hamstring and or patellar tendon that they gotten the graft from. Sometimes they get graft from cadaver, which is perfect. They can get actual ACL of the cadaver and graft it to you. If you don't reject it, perfect. It's going to be a very good surgery. But it has a lot of precautions. So these surgeries, most likely you have to make sure that you only do the very, very easy exercises, which I'm going to try to show you the easy exercise. For knee replacement, you don't have that much precautions, because imagine you are metal on metal, no ligaments that it's sewed up, that you want to make sure that it doesn't tear. So basically everything is stable in place with the metal. So you don't have that much precaution, but still you have to make sure that you don't overdo stuff in the first weeks. So I'm going to show you a couple of easy exercises. The isometric one. How we do isometrics on the knee? We're going to put some either pillow or towel in there underneath your knee, and then you're going to press that knee to the floor and hold and relax. Press until you feel that contraction in that quad muscle. 1, 2, 3, 4, 5, relax. 2, 3, 4, 5, relax. And we contract this muscle and try to get the contraction only without any movement. When we try to get that contraction from the hamstring though, we can do this. We can still keep it that, but we're gonna press with the heel this time. We're pressing with the heel, holding it and relaxing. Pressing with the heel, holding, relaxing. Pressing with the heel. That way we're gonna feel that contraction in the hamstring instead of the quads. So these are 2 isometric exercises. That's very important. Another exercise which is gonna be very easy and important is heel slide. It can be done in the first stage of any kind of surgery. Make sure you can go. Sometimes you don't have enough range of motion. The purpose of it is try to give you more range. Go as much as you can. Sometimes you're stuck here, try to push it. Sometimes you're stuck here, try to push it little by little. And if you can't, then you can go ahead and grab a towel again, put the towel in here, and then what you can do, you go up and down with the towel. Okay, the towel is a helper, okay? It helps you to do the motion. Okay? Sometimes if you can do it in a sideways position also. That's going to be another option. If you feel better on side-lying position, you can do that. Try to grab it and do that in side bend position. Get as much as flexion as possible. And also extension. Sometimes if it doesn't bother you in your kneecap, you can go ahead and do this. Lay on your stomach. And pull it as much as you can. But that's going to be a little bit harder. You can save it for later. Okay? These are the very easy exercises that you can start your therapy with. As soon as you feel that your quad muscles started getting a little bit of contraction and you can take the foot off the floor, at this stage, remember, you usually have the very hard brace. You take the brace off with the, with the permission of your doctor in a non-weight bearing position. Probably for walking, you still have to have a brace, but for non-weight bearing, you can take it off and make sure you tighten up your own muscle and go up and down, which we call it straight leg raise. Very important. Okay, you can even try to do a little bit of this without the weight in the next stage. Okay, shoulder quads without the weight, no weight at this point. That's going to be very safe also. Okay, you can start doing your hamstring curl in the sideways if you want, and then you can do hamstring curl on the prone as much as you can tolerate the range again. These are all easy exercises you can do. Most of the time is a good idea if you can find your patella. I showed you where is your patella or kneecap before, the bone that's movable. You can go ahead and move it little by little, not too much. You don't want to dislocate your patella, very little. You can try to play with it up and down, a little bit and side to side to make sure you preserve that motion, because sometimes because of having brace for a long time, that patella gets really tight and gets a scar tissue around it, so we don't want to let that happen. So you can of course do a lot of massages to increase the blood flow, especially in your quads, to let that quad get activated. You can massage your scar a little bit. How to massage the scar is, for example, if you have a scar like this, in case of knee replacement, which is a big scar usually in the front, you can go 90 degrees against that scar, which is usually the scar is like this, vertical. You're going to go horizontally on top of your scar and try to release it, the areas that's attached to the underneath tissue. So these are something that you can do after surgeries. So very important to make sure that you do some kind of stretches little by little. You can do hamstring stretch with the towel also. You can grab a towel and try to do hamstring stretch a little bit. Okay, stretching your calf also helps. Gastrocnemius, remember we told you that it's important to stretch the gastrocnemius also. You can do side lying. If you want, you can put a pillow in between your legs to make it more comfortable, less strain force. You can do this. Make sure it's towards the back so you don't activate your IT band, you activate your glute medius. Is a good one. If you can't tolerate the extension, you can do the hip extension in this position, because imagine after the surgery you're not going to be able to get to that position. That's the no-no. You're not going to be able to get to that position because it's going to hurt your kneecap. It's right after surgery, remember? So you don't have to do this. So you're going to lay on your stomach and lift your hip up and down for extension. So if you want, you can do this one. This is a good one too, to try to tighten up your muscles inside And we like to, of course, do it with a little bit of extension if it's possible. That helps you to activate your VMO, which is the muscle, the inside part of your quadriceps that's usually weak. While you're pressing the ball or pressing a pillow, you do that extension. It's going to be a very good exercise for you to do. Sometimes if you don't have enough extension, you have lack of extension, imagine your foot stays like this, your knee stays like this, lack of extension. So what we can do, we can go ahead and put something heavy on it. I'm going to put this for you so you can see. I'm going to put this on top of it. Imagine if I put it for 15 minutes, 20 minutes, what's going to happen? It can gradually get more extension. That's what we want. Sometimes we need to do that. Sometimes for the flexion, if we don't have enough flexion, for example, we're really limited for the flexion. We are up here, so we put this down here, so it helps us to flex a little bit more. Imagine if we are like here, stuck in here, we cannot flex the knee. This is going to help us flex the knee. So a lot of things for exercises for different stages of the surgery, but these are the most important things that you can do. And of course, in the later stages, you can use your previous videos. They are for later stages, and they definitely help you to strengthen more and more to be able to get your agility back, hopefully get you ready for the sport in the future. Sometimes my patients are really into sport, and after this kind of surgery, the athletes, their goal is get to that agility exercises, and don't think that's not gonna happen because you're so limited at the first days of surgery. That's normal. The first days of surgery is terrible. The first weeks of surgery is bad, and after a while, you're gonna get back to everything you wanna get back to.